Okay, so I went through just regular 40-year-old stuff. What is this?
That looks like a bottle of Kunal Ultra CoQ10 supplements. It's often used to support heart health and boost energy levels.
And what about this?
That's a bottle of ibuprofen, which is commonly used as a pain reliever and to reduce inflammation or fever.
And what about this?
That looks like a nasal spray called Xelir. It's typically used to help clear nasal congestion and moisturize sinus passages.
Can I use all three of these together? Are there any medication interactions?
Generally, these three are safe to use together for most people, but it's always best to check with a healthcare professional to ensure there are no specific interactions or concerns based on your personal health conditions or other medications you might be taking.
So now, guys, I want to show you something very important, such as food. So GPT, look at this. Tell me, based off of these ingredients, is this safe to feed someone with high blood pressure and cholesterol?
This arrabbiata sauce contains tomato pulp, extra virgin olive oil, spicy chili peppers, sugar, salt, onion, and garlic. While tomatoes and olive oil are generally healthy, the salt content could be a concern for someone with high blood pressure. It's best to check the sodium content and consult with a healthcare provider or a dietitian for personalized advice.
And what about this? What if I wanted to give this every morning to my people with diabetes and they like this in their coffee, such as this paired with coffee creamer?
This vanilla syrup contains pure cane sugar, which can spike blood sugar levels, so it's not ideal for someone with diabetes. It's better to use a sugar-free syrup or...
So guys, I want you to see the care plan that's right here. GPT, look at this care plan and give me an overview of this client before I admit them into senior living.
Sure, the care plan for Mrs. Eleanor Smith notes that she's an 86-year-old widow who recently moved into the community. She's vibrant and socially active, enjoys music, gardening, and weekly salon visits. She has mild cognitive impairment affecting memory and decision-making, hypertension, osteoarthritis in her knees and hips, and seasonal allergies. The plan aims to maintain her independence, enhance cognitive function, manage pain, and support emotional well-being through a combination of physical activities, cognitive exercises, medication management, personalized nutrition, and social engagement. Overall, she seems to need a supportive environment that encourages independence while addressing her health and cognitive needs.
Based off of what we just saw about Miss Eleanor, would she be an excellent candidate for senior living?
Yes, she seems like a great candidate for senior living. Her mild cognitive impairment, need for social engagement, and the various health conditions she's managing would benefit from the supportive environment and structured care that senior living provides. Plus, the community can help her stay active, socially connected, and maintain her independence.
Now guys, we're going to try something a little bit more harder. GPT, read over this full of graphs and charts and give me a summary of what it entails.
This document focuses on the impact of inflation on retirement savings. It highlights how inflation erodes purchasing power over time, making it crucial to plan for rising costs. The graphs show how inflation rates have surged in recent years and project how different inflation rates can significantly reduce the value of a fixed amount of savings over 10, 20, and 30 years. It also emphasizes strategies to protect a retirement income from inflation risk, such as investing in assets that outpace inflation and considering annuities or other insurance products. The key takeaway is that retirees need to account for inflation to maintain their standard of living throughout their retirement years.